Hi everyone, welcome back to another video. Today I will be talking about Medicare interim final rule with request for comments for prescription drug and healthcare spending. Let's get right into it. On November 17th of 2021, the Department of Health and Human Services or HHS, together with the Department of Labor or DOL and the Department of the Treasury, collectively the departments, as well as the Office of Personnel Management or OPM, released an interim final rule with request for comments IFC entitled Prescription Drug and Healthcare Spending. This IFC or interim final rule with request for comments implements new requirements for health plans and health insurance issuers in the group and individual markets to submit to the department certain information about prescription drug and healthcare spending. The same information will be submitted by Federal Employees Health Benefits or FEHB program carriers in coordination with Office of Personnel Management or OPM. The departments will issue biennial public reports on prescription drug pricing trends and the impact of prescription drug cost on premiums and out-of-pocket costs starting in 2023. These reports are expected to enhance transparency and shed light on how prescription drugs contribute to the growth of healthcare spending and the cost of health coverage. Summary of the November 17, 2021 Interim Final Rule with Request for Comments or IFC. The information that this interim final rule with request for comment requires plans and issuers in the group and individual markets to submit on prescription drug and other healthcare spending to the departments annually includes general information regarding the plan or coverage, enrollment and premium information including average monthly premiums paid by employees versus employers, total healthcare spending broken down by type of cost such as hospital care, primary care, specialty care, prescription drugs, and other medical costs, including wellness services, including prescription drug spending by enrollees versus employers and issuers. The 50 most frequently dispensed brand prescription drugs, the 50 costliest prescription drugs by total annual spending, the 50 prescription drugs with the greatest increase in plan or coverage expenditures from the previous year, prescription drug rebates, fees, and other remuneration paid by drug manufacturers to the plan or issuer in each therapeutic class of drugs, as well as for each of the 25 drugs that yielded the highest amount of rebates and the impact of prescription drug rebates, fees, and other remuneration on premiums and out-of-pocket costs. The interim final rule with request for comments provides that plan sponsors, issuers, and federal employees' health benefits carriers generally will be required to submit this information aggregated at the state/market level rather than separately for each plan, to ensure that the departments and Office of Personnel Management or OPM are able to conduct meaningful data analysis and identify prescription drug trends. The IFC or interim final rule with request for comments further provides uniform standards and definitions, including for identifying prescription drugs regardless of the dosage strength, package size, or mode of delivery. The Consolidated Appropriations Act of 2021 or CAA requires plans and issuers to begin submitting the required information to the departments by December 27th of 2021 and to submit this information by June 1st of each year thereafter. However, the departments have announced that they will exercise discretion to provide temporary deferral of enforcement with regard to the December 27, 2021 and June 1, 2022 deadlines, and that they will not initiate enforcement action against a plan or issuer that submits the required information for 2020 and 2021 by December 27th of 2022. Office of Personnel Management or OPM also will allow its federal employees' health benefits carriers to report information for 2020 and 2021 by December 27th of 2022. Comments on this interim final rule with requests for comments are due at 5 p.m. on January 24th of 2022. In commenting, refer to file code CMS 9905 IFC. You may submit electronic comments on this regulation at the website I have pasted on this slide by entering the file code in the search window and then clicking on Comment. You can also find this information in the description box below. Hope this video provided you some value. If you like this video, please consider subscribing to my channel. Thank you for joining me today. Bye now.